You're just a substitute." Dr. Thomas Harrison's voice cut through the sterile air of the surgical floor like a scalpel through tissue. "Don't get in the way tonight." Dr. Maya Torres stood in the doorway of the surgical prep room, her brown eyes steady as Harrison looked her up and down, with barely concealed disdain. Behind him, 3 residents exchanged glances, their expressions a mixture of curiosity and amusement. It was 2:15 a.m., and the night shift at Metropolitan General Hospital was just beginning. Maya adjusted her surgical mask without responding, her movements economical and precise. She'd been through worse reception than this. 6 years in combat zones had taught her that silence was often the best response to hostility. She pulled her dark hair back into a tight bun, revealing the strong line of her jaw and the faint shadows under her eyes that spoke of too many sleepless nights. Harrison was exactly what she'd expected. 50 years old, silver hair perfectly trimmed, posture rigid with authority. His white coat was immaculate, pressed with military precision, though he'd never served a day in uniform. She could tell by the way he carried himself, the way he expected deference without having earned it in the trenches. "We're short-staffed tonight," Harrison continued, addressing the residents rather than Maya. "Dr. Chen is out with the flu, which is why administration sent us this temporary replacement." He gestured toward Maya with his clipboard. "She'll handle the routine cases. Appendectomies, gallbladders, nothing complex." One of the residents, a young man with wire-rimmed glasses, spoke up. "What's your background, Dr. Torres?" Maya reached for her locker, pulling out the standard green scrubs. "General surgery, various hospitals. I've seen my share of emergencies." "Various hospitals," Harrison repeated, his tone making it clear what he thought of that vague resume. "Well, here at Metropolitan, we have standards, protocols. We don't improvise, and we certainly don't freelance. You follow my lead. You consult before making any significant decisions, and you document everything. Understood?" "Understood," Maya said quietly. As she changed into her scrubs, Maya caught sight of her reflection in the small mirror inside her locker. 34 years old, and she looked every day of it. The past 3 years since she'd left the military had been about hiding, about building a new identity far from the person she'd been. Major Maya Torres, MD, U.S. Army Medical Corps, had ceased to exist officially. Now she was just Dr. Torres, temporary substitute, drifting from one short-term position to another. She rolled up her sleeves, then paused. On her left wrist, partially visible beneath where her watch would go, was the edge of a tattoo, just a hint of dark ink, geometric lines that could be anything to someone who didn't know what to look for. Maya quickly fastened her watch over it, making sure the band covered the mark completely. "Dr. Torres," one of the nurses called from the doorway. Her name tag read, J. Patterson, and unlike the residents, her expression held no judgment, only the weary professionalism of someone who'd worked too many night shifts. "We've got your first case prepped. OR3, routine appendectomy, 42-year-old male." Maya nodded and followed the nurse down the corridor. The hospital was quieter at this hour, the fluorescent lights harsh against the pale walls. She'd worked in dozens of hospitals over the past 3 years, and they all felt the same. Sterile, anonymous, safe. Nothing like the field hospitals in Afghanistan, where mortar rounds could shake the building while you were elbow-deep in someone's chest cavity. As they walked, Maya felt a familiar tremor in her hands. It lasted only a second, a ghost of memory trying to surface. She clenched her fists briefly, forcing the sensation away. Not here. Not now. OR3 was standard issue. Gleaming steel, bright lights, monitors waiting to display vital signs. The surgical team was already assembled. 2 nurses, an anesthesiologist, and a surgical tech who couldn't have been more than 25. They all watched Maya with that same expression she'd seen countless times. Who is this person? Can we trust her? Maya moved to the scrub sink, methodically washing her hands with the practiced precision that came from thousands of repetitions. As she scrubbed, she noticed Nurse Patterson observing her technique. There was something in the older woman's eyes, a flicker of recognition that made Maya's pulse quicken slightly. "You military?" Patterson asked quietly. Maya kept her focus on her hands. "Why do you ask?" "The way you stand. The way you move. Patterson handed her a sterile towel. My son served. Marines. I recognize the posture. I'm just a surgeon, Maya said, keeping her voice neutral. Patterson didn't press further, but Maya could feel the woman's attention as she gowned and gloved. This was always the risk. Someone who knew. Someone who recognized the signs that civilian life couldn't quite erase. The patient was already under anesthesia when Maya entered the operating room. She approached the table, her eyes immediately scanning the monitors. Heart rate steady, blood pressure within normal limits, oxygen saturation good. Standard pre-op vitals for a routine appendectomy. Ready when you are, doctor, the anesthesiologist said. Maya positioned herself at the table, her hands hovering over the surgical field. For a moment, she felt the weight of all the eyes on her. The residents watching from the observation gallery above. Harrison somewhere in the hospital, waiting for her to prove him right about substitute surgeons. The surgical team around her, reserving judgment. Scalpel, Maya said. The instrument was placed in her hand with the familiar weight of purpose. She made the first incision with a steady hand, the muscle memory of countless surgeries guiding her movements. But as she worked, exposing the abdominal cavity, something caught her attention. A smell, faint but distinct, not the expected scent of a straightforward appendectomy. Maya paused, her trained senses processing information that the monitors couldn't provide. The tissue looked slightly different than it should. The coloration was off, the texture suggesting something more serious than simple appendicitis. Something wrong? The surgical tech asked. Maya's mind raced through possibilities. This wasn't what they'd diagnosed. This was worse. Possibly peritonitis, possibly sepsis beginning to take hold. The kind of complication that could kill someone if missed. She needed to tell Harrison. That was protocol, but she could already imagine his response. The substitute surgeon second-guessing the diagnosis, seeing problems where none existed. He'd tell her to proceed as planned, to stop wasting time. Dr. Torres? Nurse Patterson's voice held a note of concern. What do you see? Maya made her decision. Continue monitoring vitals closely, she said. This might take longer than expected. As she worked deeper into the surgical field, Maya's hands moved with a confidence that came from experience far beyond civilian hospital walls. She'd operated in tents while the ground shook from explosions. She'd performed surgery by flashlight when generators failed. She'd made life and death decisions with no one to consult, no backup plan, no margin for error. This should have been simple, but in Maya's experience, nothing ever stayed simple for long. If you want to see how a substitute surgeon shocks an entire hospital, make sure you subscribe to Emergency Heroes Stories. Where are you watching from? Because what happens next will challenge everything you think you know about who belongs in an operating room. The monitors beeped steadily as Maya worked, her hands moving with practiced precision through tissue that revealed its secrets only to those who knew how to look. Above her, in the observation gallery, she could feel the weight of watching eyes. She was being tested, judged, measured against standards set by people who had never held a dying soldier's heart in their hands at 3 a.m. while rockets fell outside. Maya Torres had spent 3 years trying to forget who she'd been. But tonight, in OR 3 of Metropolitan General Hospital, the past was beginning to catch up with her, and there was no stopping what was coming next. The residents' lounge smelled like burnt coffee and exhaustion. Dr. Ryan Chen sat slouched in one of the worn chairs, scrolling through his phone while Dr. Jennifer Park leaned against the vending machine, arms crossed. The young resident with wire-rimmed glasses, whose name tag read Dr. Marcus Webb, stood by the window watching the parking lot. "Did you see her technique in that appendectomy?" Webb asked, not looking away from the glass. The way she handled the tissue. That wasn't standard. "Lucky guess," Chen said without looking up from his phone. "Probably stayed up all night watching surgical videos on YouTube. Everyone thinks they're a prodigy these days." Park pushed off from the vending machine. "Nobody learns to move like that from videos. I was watching from observation." Her hand placement was different. The way she controlled bleeding before it even started, like she could predict where the blood vessels would be without looking. "She's probably been studying the anatomy atlases obsessively," Webb suggested, though his tone suggested he didn't quite believe his own explanation. "Overcompensating because she knows she's temporary. Trying to prove something. Or maybe she's just good, Park said. Chen finally looked up. Good? She appeared out of nowhere with a resume that's basically blank. No publications, no letters of recommendation from anyone we've heard of, no fellowship training. Harrison said she's been bouncing between hospitals for 3 years. That's not the pattern of someone who's good. That's the pattern of someone who can't hold a position. The door opened, and Nurse Patterson entered, moving toward the coffee maker with the weariness of someone who'd seen too many shifts blur together. She'd worked at Metropolitan General for 23 years, longer than any of the residents had been practicing medicine. You three talking about Dr. Torres? Patterson asked, her voice carrying the flat certainty of someone who knew exactly what was being discussed. Just wondering about her background, Park said carefully. Her technique is unusual. Patterson poured coffee into a chipped mug that had World's OKest Nurse printed on the side. Unusual isn't always bad. Sometimes it's just different. Sometimes different is what saves lives. Has she said anything to you about where she trained? Webb asked. Her file is really sparse. Patterson took a sip of the terrible coffee, her expression unreadable. Some people have reasons for keeping their past private. Maybe you should focus on what she can do now, not where she's been. She left before any of them could respond, her orthopedic shoes squeaking slightly on the linoleum floor. The residents exchanged glances in the silence that followed. 23 years here, and Patterson never vouches for anyone, Chen said slowly. Not even attending physicians get that kind of defense from her. Meanwhile, 3 floors up, Maya stood at the scrub sink outside OR3, washing her hands for what felt like the 100th time that night. The surgery had gone well. The patient's perforated appendix had been addressed, the peritonitis caught before it could progress to sepsis. She'd documented everything meticulously, following every protocol Harrison had outlined. But she'd known. The moment she'd opened the abdominal cavity, she'd known this wasn't routine. The signs had been there for anyone trained to see them. The subtle discoloration, the smell, the way the tissue resisted her instruments. In Afghanistan, she'd learned to trust her senses beyond what monitors could tell her. In field hospitals, you didn't always have the luxury of waiting for lab results or imaging confirmation. You learned to read the body's language directly. Dr. Torres. Harrison's voice cut through her thoughts. Maya turned to find the chief surgeon approaching, his white coat still immaculate despite the hour. Behind him, she noticed Webb and Park in the hallway, trying not to look like they were eavesdropping. The appendectomy, Harrison said, his tone neutral. I reviewed the operative notes. You documented a perforated appendix with early peritonitis. That's correct. The preoperative imaging didn't indicate perforation. The lab showed elevated white count, but nothing that suggested perforation. Harrison's eyes narrowed slightly. How did you know before you opened? Maya chose her words carefully. Clinical presentation, the patient's pain pattern, the rigidity of the abdomen, the subtle signs that imaging doesn't always capture. I've seen similar cases before. Where? Harrison asked directly. Which hospital? Under which attending? Various places, Maya said. Different emergency situations. You learn to recognize patterns. Harrison studied her for a long moment. The hallway seemed to grow quieter, as if everyone present was holding their breath. Patterns, he repeated. Dr. Torres, I've been practicing surgery for 26 years. I've trained dozens of residents. And I've never seen a surgeon with your claimed limited experience identify complications with that level of certainty before even seeing them. Maya met his gaze steadily. Sometimes experience comes from unexpected places. I'll be watching your next case more closely. Harrison said, We have another surgery scheduled for you at 6 a.m. Standard gallbladder removal. Try not to find any hidden complications in that one. He walked away, his shoes clicking against the floor with measured precision. Maya could feel the weight of the residents' stares, could sense their curiosity mixing with suspicion. She'd been too visible, too competent. In 3 years of moving between temporary positions, she'd learned that the key to survival was being good enough to avoid criticism, but not so good that people started asking questions. She'd broken that rule tonight. Maya headed toward the on-call room, her body aching with the familiar exhaustion of night shifts. As she walked, she passed the residence lounge. Through the window in the door, she could see Chen, Park, and Webb huddled together, their animated gestures making clear they were discussing something intensely. She didn't need to hear the words to know she was the topic. The on-call room was small and utilitarian. A narrow bed, a locker, a desk with a chair. Maya sat on the bed and pulled off her surgical cap, letting her dark hair fall loose. Her hands, usually steady, trembled slightly. Not from fatigue, from the familiar creep of memory trying to surface. She pulled out her phone and stared at the blank screen for a moment, before opening her photos. There was only one album, hidden behind a password. Inside were images she rarely let herself see. A photograph of her in military uniform, standing outside a field hospital in Kandahar. Her face younger, harder. The eyes of someone who'd seen things that changed you fundamentally. Behind her in the photo, barely visible, was a surgical tent where she'd performed operations under conditions that would give civilian surgeons nightmares. Maya closed the album quickly and set the phone aside. That life was over. Major Maya Torres was gone. The woman who'd operated with mortars falling, who'd made decisions that saved hundreds but cost her everything, who'd refused to abandon patients even when ordered to evacuate. She'd left that behind, except it kept following her. In the way her hands moved, in the patterns she recognized, in the instincts that civilian training couldn't explain. A knock on the door pulled her from the spiral of memory. "Come in," she called. Nurse Patterson entered, carrying a fresh cup of coffee. "Thought you might need this," she said, offering the mug. "It's still terrible, but it's hot." "Thank you," Maya said, accepting the coffee. Patterson sat in the chair, uninvited, but not unwelcome. "My son, the Marine I mentioned. He did 3 tours in Helmand Province. When he came back, he couldn't settle. Couldn't stay in one place. Kept moving, kept changing jobs. Like if he stopped moving, something would catch up with him." Maya said nothing, but her grip on the coffee mug tightened slightly. "He finally told me why," Patterson continued. "He said that in the war, he'd become someone who could make impossible decisions. Someone who could function when everything was chaos. And when he came home, people couldn't understand that person. They wanted the version of him from before, the one who didn't exist anymore." The room was very quiet, except for the distant sounds of hospital machinery, monitors beeping, the soft whoosh of the ventilation system. "I'm not running from anything," Maya said finally. Patterson stood, moving toward the door. "I didn't say you were. I'm just saying that sometimes the people who are running are the ones who stop to help someone when everyone else kept moving. And that's not something to be ashamed of." She left, closing the door softly behind her. Maya sat alone in the small room, the coffee growing cold in her hands, and knew that her time at Metropolitan General was going to be shorter than most of her previous assignments. People were noticing. People were asking questions. And sooner or later, someone would dig deep enough to find answers she couldn't afford to give. Her pager buzzed. Another case, another emergency, another chance to prove Harrison right about substitute surgeons who appeared out of nowhere. Maya drank the cold coffee in one long swallow, pulled her hair back into a bun, and headed back into the fluorescent-lit hallways where the past couldn't quite reach her. Not yet. The emergency call came at 2:47 a.m., crackling through Maya's pager with the urgency that made her pulse quicken despite years of training. Code Blue, OR3. All available surgical staff. Maya was moving before the message finished, her feet carrying her down the corridor with practiced speed. Behind her, she heard the rapid footsteps of residents and nurses responding to the same alert. The patient from her earlier gallbladder surgery had crashed. She burst through the OR doors to find organized chaos. The surgical tech was performing chest compressions while an anesthesiologist bagged the patient manually. Monitors screamed their warnings into the sterile air. Blood pressure dropping, oxygen saturation plummeting, heart rhythm deteriorating into something that looked like ventricular fibrillation. "What happened?" Maya demanded, moving to the table. "Post-op hemorrhage," the anesthesiologist reported, sweat beading on his forehead. "Started bleeding internally about 10 minutes ago. We got him back to the OR, but he arrested as soon as we opened him up." Harrison appeared in the doorway, his white coat abandoned somewhere, sleeves rolled up. He took in the scene with a single glance. Dr. Torres, step back. I'll take over from here. Maya hesitated for only a fraction of a second. With respect, sir, I know this patient's anatomy. I did the initial surgery, which apparently wasn't done correctly if he's bleeding out on my table, Harrison snapped. Now step back. The monitors continued their alarming chorus. Every second of debate was a second closer to brain death, to a patient who would never wake up. Maya looked at the bleeding surgical field, at the desperate compressions that weren't bringing the patient back, and made a decision that would change everything. Scalpel, she said, her voice cutting through the chaos with military authority. The surgical tech's hands moved automatically, placing the instrument in Maya's palm before Harrison could countermand the order. Maya's fingers closed around the familiar weight as Harrison's face darkened with fury. Dr. Torres, I am ordering you to. Maya's hands were already moving. She extended the incision with 3 precise cuts, exposing the abdominal cavity fully. Blood welled up, obscuring the field, but Maya's movements didn't slow. Her left hand moved to apply pressure to specific points along the abdominal wall, while her right worked deeper. Suction, she commanded. Large bore. Now. Nurse Patterson appeared at her side, anticipating Maya's needs before she voiced them. The suction cleared the blood enough for Maya to see what she'd suspected. The hemorrhage wasn't from her original surgical site. It was from a vessel that had been weakened by years of undiagnosed disease. A time bomb waiting to explode. Maya's fingers moved with a speed that made the watching residents lean forward in the observation gallery. She wasn't following standard civilian protocol. Her suture pattern was different, tighter, designed for speed over aesthetics. Her hands positioned themselves at angles that maximized efficiency while minimizing tissue trauma. That's not standard technique, Webb whispered from the gallery. No, Park breathed. That's military field suturing. I've seen it in combat medicine journals. It's designed for situations where you have 3 minutes to stop bleeding or the patient dies. In the OR, Maya worked with absolute focus. Her movements were economical, precise, each motion serving a purpose. She isolated the bleeding vessel, clamped it, tied it off with a pattern of interrupted sutures that formed a distinctive geometric configuration. Clamp, she said. Small Richardson, retractor. Tie. Each instrument appeared in her hand the instant she needed it. The surgical team had fallen into sync with her rhythm, responding to the authority in her voice, rather than the rank on her badge. Even Harrison had gone silent, watching with an expression that mixed anger with something that might have been grudging recognition. Maya's hands never trembled. Not when she reached deep into the abdominal cavity to repair a vessel that should have required 2 surgeons to access. Not when she tied off bleeders with one hand while maintaining pressure with the other. Not when she performed a procedure in 6 minutes that typically took 20. The monitors changed their tone. The flat line began to show spikes. Weak at first, then stronger. We've got sinus rhythm, the anesthesiologist reported, his voice filled with disbelief. Pressure is coming back up. Oxygen saturation improving. Maya didn't pause. She completed the vascular repair, checked for additional bleeding sites, irrigated the cavity, and began closing. Her suture line was perfect, each stitch placed with mechanical precision. The entire procedure, from her first incision to the final closing suture, took 43 minutes. When Maya finally stepped back from the table, the patient's vitals had stabilized completely. The crisis was over. The OR was absolutely silent except for the steady beeping of monitors showing normal rhythms. Every person in the room was staring at Maya. The surgical tech's mouth hung slightly open. Nurse Patterson's eyes were bright with something that looked like vindication. Harrison's expression was unreadable. That suture pattern, Harrison said slowly, his voice carefully controlled. Where did you learn that? Maya stripped off her blood-soaked gloves, dropping them in the biohazard container. Various places, she said, but even she could hear how inadequate the answer sounded. Various places don't teach military field surgery techniques, Harrison said. Those interrupted sutures with the reinforced anchoring pattern, that's what combat surgeons use when operating under fire. I've seen it in research papers from military trauma centers. I've never seen it performed in a civilian hospital. Webb burst through the OR doors from the observation gallery, his face flushed with excitement. "Dr. Torres, that was incredible. The way you accessed that posterior vessel without needing a second pair of hands. How did you even know it was there?" "Experience," Maya said shortly. "What kind of experience?" Park had followed Webb, her eyes sharp with curiosity. That wasn't just good technique. That was something else entirely. Maya felt the walls closing in. Every question, every observation, every moment of attention was pulling her further from the anonymity she'd worked so hard to maintain. She could see Harrison's mind working, connecting pieces, forming conclusions. "Dr. Torres," Harrison said, his tone leaving no room for evasion. "My office. Now, the patient needs post-op monitoring," Maya said. "I should—" "The patient is stable thanks to whatever the hell that was you just did," Harrison interrupted. "The recovery team can handle the rest. You and I need to have a very direct conversation about your credentials." Maya followed Harrison out of the OR, feeling the weight of eyes on her back. In the hallway, she caught sight of her reflection in a window. Her scrubs were soaked with blood, her face pale with exhaustion, but her eyes held something she hadn't seen in 3 years. The look of someone who'd stopped hiding, even if only for 43 minutes. They passed a clock on the wall. 3:32 a.m. 45 minutes since the code had been called. 45 minutes that had saved a life and possibly destroyed the carefully constructed anonymity Maya had built. Harrison's office was on the administrative floor, away from the surgical suites. As they walked, Maya ran through scenarios in her mind. She could quit now, walk away before anyone dug deep enough to find the truth. She'd done it before. Left positions when questions became too pointed, when people started looking too closely. But something had shifted tonight. When she'd picked up that scalpel despite Harrison's orders, when she'd let her training take over completely, she'd crossed a line. There was no going back to being invisible now. Harrison held the door open, gesturing for Maya to enter first. His office was neat, organized, diplomas covering one wall, surgical textbooks lining shelves, a desk with a computer showing a half-finished operative report. "Sit," Harrison said, moving to his chair. Maya remained standing. "I'd rather not, if it's all the same to you." Harrison studied her for a long moment. "In 26 years of practicing surgery, Dr. Torres, I've seen a lot of talented physicians, residents who show promise, attendings who demonstrate excellence. But what I just witnessed wasn't talent. It wasn't even excellence. It was something that comes from a very specific type of training, the kind of training that costs 6 years of your life and requires you to take an oath most surgeons never make." Maya said nothing. "So I'm going to ask you directly," Harrison continued. "Are you, or were you, a military surgeon?" The question hung in the air between them. Maya could lie, could deflect, could walk out of this office in this hospital and start over somewhere else for the 14th time in 3 years. Or she could tell the truth and face whatever came next. Her hands finally began to tremble. Before Maya could answer Harrison's question, the hospital's emergency alert system shattered the tension in the office. The mechanical voice echoed through the building, cold and urgent. "Mass casualty incident. All available surgical staff report to emergency department immediately. Repeat. Mass casualty incident. Multiple critical injuries inbound. ETA 3 minutes." Harrison was already moving, his earlier interrogation forgotten in the face of immediate crisis. He grabbed his white coat from the hook behind the door. "How many casualties?" he demanded into his phone, already dialing the ER. Maya followed him into the hallway, her exhausted body finding reserves of energy from muscle memory trained in far worse conditions than this. Around them, the hospital transformed. Nurses appeared from break rooms, residents materialized from on-call quarters, surgical techs rushed toward the ER with equipment carts rattling behind them. "Report says 18 critical, multiple stable," Harrison said into his phone as they moved. "Vehicle collision on Highway 95. Military convoy and civilian traffic." He glanced at Maya. "You're with me whether I trust you or not. We need every surgeon we have." They reached the emergency department as the first ambulances screamed into the bay. The doors burst open and paramedics rushed through with gurneys carrying twisted bodies, blood, and chaos. Maya's training kicked in automatically, her eyes scanning and categorizing injuries in the split seconds before the patients even reached the trauma bays. Trauma 1, penetrating chest wound, probable hemothorax, a paramedic shouted. Trauma 2, multiple fractures, internal bleeding suspected. Trauma 3, head injury, GCS of 6. The organized chaos of mass casualty protocol unfolded around them. Harrison took command, his voice cutting through the noise. Chen, Park, take Trauma 1. Webb, Rodriguez, Trauma 2. Torres, you're with me on Trauma 3. Maya moved toward Trauma Bay 3, but something caught her peripheral vision. A patient being wheeled past on a gurney, a military uniform visible beneath the blood-soaked emergency bandages. The paramedic beside him was struggling with the IV line, the soldier semi-conscious and mumbling. As Maya passed, the soldier's eyes fluttered open, his gaze locked onto her face, and something changed in his expression. Recognition. His hand shot out, grabbing her wrist with surprising strength for someone so injured. Wait, he gasped, his voice rough. I know you. Maya's pulse spiked. The soldier's face was familiar in the way that all young service members were familiar. That universal look of someone who'd seen combat. But his eyes held specific recognition, the kind that meant he'd seen her before, in uniform, in a context that could unravel everything. You're confused, Maya said gently, trying to extract her wrist from his grip. You've been in an accident. Let the paramedics help you. Fallujah, the soldier whispered, his eyes unfocused but insistent. Medical tent. You operated. You saved. He coughed, blood speckling his lips. Captain Torres. You're Captain Torres. The corridor seemed to freeze around them. Nurse Patterson, who'd been walking past with a crash cart, stopped. Webb, standing in the doorway of Trauma 2, turned to stare. Even the paramedic holding the soldier's IV bag looked at Maya with sudden, sharp interest. Dr. Torres. Harrison's voice cut through the moment like a blade. Trauma 3. Now. Maya pulled her wrist free and moved toward the trauma bay, but she could feel the weight of eyes following her. The soldier's words hung in the air like smoke, impossible to dismiss, impossible to ignore. Trauma Bay 3 contained a patient who was dying. The monitors told the story in harsh beeping warnings. Blood pressure crashing, oxygen saturation dropping, pupils becoming unequal and sluggish. Classic signs of increasing intracranial pressure from head trauma. Harrison was already gowned and gloved, his hands moving over the patient's skull. We need to relieve the pressure now, or we lose him. Burr hole procedure. Torres, you're assisting. Maya scrubbed in with practiced speed, her mind compartmentalizing. The soldier's recognition didn't matter right now. This patient mattered. This moment mattered. She could deal with the consequences later. As they worked to drill through the skull and relieve the hematoma pressing against the patient's brain, the ER around them continued to receive casualties. The sounds filtered through the trauma bay doors. Shouts for blood products, calls for more hands, the controlled urgency of medical professionals dealing with too many critical patients and too few resources. Suction, Harrison commanded. More light here. Torres, I need you to hold retraction at exactly this angle. Any movement and we hit the dura wrong. Maya's hands positioned the retractor with absolute precision. Through the open doors, she could see paramedics continuing to bring in patients. Military and civilian casualties mixed together. The accident having occurred when a convoy transporting personnel collided with civilian vehicles at a highway interchange. Another soldier was wheeled past Trauma 3, this one more alert. His eyes scanned the visible medical staff, then stopped on Maya. Even through the trauma bay window, she could see his expression change. The same look of recognition, followed by confusion. A military surgeon here? In civilian clothing? Operating in a metropolitan hospital? Dr. Torres, focus, Harrison snapped, pulling her attention back to the delicate work of relieving cranial pressure without causing additional damage. The procedure took 26 minutes. By the time they'd stabilized the patient enough for transfer to the ICU, the initial wave of critical casualties had been addressed. The ER had transformed into organized chaos, with patients occupying every bay, monitors creating a symphony of competing alarms, and medical staff moving between cases with controlled urgency. Maya stripped off her gloves and stepped into the hallway to find Webb waiting, his expression caught between excitement and confusion. "Dr. Torres, that soldier who grabbed you," Webb said quickly. "He keeps insisting he knows you from military service. He says you're a captain. He says you operated on him in Iraq. Is that true?" Before Maya could formulate a response, Park appeared with her tablet showing something that made Maya's stomach drop. "I looked you up," Park said, her voice low but intense. "Standard background check. There's almost nothing on you before 3 years ago. No social media, no publications, no conference presentations. It's like you didn't exist until you started showing up at temporary positions. But I found something." She turned the tablet around. "A military medical journal from 5 years ago. Research on field trauma techniques in combat zones. One of the authors is listed as Major M. Torres, U.S. Army Medical Corps." The hallway seemed to tilt slightly. Maya's carefully constructed civilian identity, 3 years of running and hiding, was crumbling in real time. Harrison appeared from Trauma 4, his scrubs blood-stained, his expression exhausted but sharp. "Dr. Torres, several of these military casualties are requesting you specifically. They're saying you're former Army, that you served with distinction." He paused, his eyes boring into hers. "So I'm going to ask you one more time, and I want a direct answer. Are you a military surgeon?" Maya opened her mouth, not sure what would come out, when the ER doors burst open again. But this time it wasn't paramedics. It was 2 military officers in dress uniform, their bearing unmistakably command level. Behind them came another gurney, this one surrounded by more personnel than any civilian casualty warranted. "Clear the bay," one of the officers commanded. "We have a priority patient requiring immediate surgical intervention." Harrison stepped forward, his authority as chief surgeon reasserting itself. "I'm Dr. Harrison, chief of surgery. All our trauma bays are occupied. You'll need to wait your turn according to triage protocol." The officer's expression didn't change. "This patient isn't waiting. This is Colonel Richard Colson, commanding officer of the 82nd Medical Battalion. He's sustained severe thoracic trauma and requires immediate surgery. He's also requested a specific surgeon." The officer's eyes scanned the ER until they locked onto Maya. "Major Torres." "The colonel is requesting Major Torres." The entire ER seemed to stop. Every resident, every nurse, every attending physician within earshot turned to stare at Maya. Harrison's face went through several expressions in rapid succession. Shock, realization, anger. Something that might have been respect. "There is no Major Torres here," Harrison said slowly. "There's only Dr. Torres, a temporary surgical substitute." The officer pulled out a tablet, showing official military records. "According to our database, Major Maya Torres, U.S. Army Medical Corps, served 6 years with distinction, 3 combat tours, over 800 surgical procedures in field conditions, decorated for valor, expert in combat trauma." The officer looked directly at Maya. "The colonel knows your record, Major. He's specifically requesting you for his surgery. Will you accept?" Maya stood in the fluorescent-lit ER, surrounded by the wreckage of her civilian disguise, facing the moment she'd been running from for 3 years. Every person in the department was watching her. Harrison, the residents who'd doubted her, Nurse Patterson, who'd suspected, the wounded soldiers who'd recognized her. She could refuse, could walk out right now, could disappear like she'd done from 13 other hospitals, or she could step forward and become Major Torres again, even if only for one more surgery. The colonel on the gurney stirred, his eyes opening slightly. Through the oxygen mask, his voice was barely audible. "Need the best. Need Major Torres. Don't let me die." Maya felt something break inside her, the wall between who she'd been and who she'd tried to become finally crumbling completely. She looked at Harrison, then at the military officers, then at the dying colonel on the gurney. Then she pulled herself to attention with a posture that hadn't been visible in 3 years, and gave the only answer she could. "I'll take the case." They moved Colonel Colson to OR1, the largest surgical suite Metropolitan General had. Maya walked beside the gurney, her mind shifting into a mode she hadn't accessed in 3 years. Combat assessment, threat evaluation, resource allocation under impossible constraints. The colonel's vitals were deteriorating by the minute, blood pressure dropping despite maximum fluid resuscitation. Oxygen saturation hovering at 87%, even with supplemental oxygen. His chest showed the telltale asymmetry of a tension pneumothorax, complicated by what looked like penetrating trauma from vehicle debris. Harrison fell into step beside her. His earlier anger transformed into something more complex. "You're really going to do this," he said quietly. "Take a case this critical when you're not even on staff officially?" Maya didn't look at him. "The colonel requested me. That makes it my responsibility." They pushed through the OR doors. The surgical team was already assembling, but there was a tension in the room that hadn't been present during earlier cases. Everyone knew now. The substitute surgeon was actually a decorated military physician. The dynamics had shifted in ways no one quite knew how to process. Nurse Patterson appeared at Maya's side as she scrubbed. "You going to tell me the truth now? About who you really are?" Maya's hands moved through the familiar ritual of surgical preparation. "Major Maya Torres, U.S. Army Medical Corps, 6 years of service, separated from active duty 3 years ago. I've been working temporary positions since then, trying to figure out how to be a civilian surgeon." "Why temporary? Why not settle somewhere?" "Because every time people find out what I was, they start treating me differently, like I'm some kind of combat hero instead of just a doctor." Maya's voice was tight. "Or they don't trust military medicine, think we're too aggressive, too willing to take risks that civilian protocols don't allow." Patterson handed her a towel. "And are you?" Maya met the older nurse's eyes. "Sometimes, when it's the difference between life and death. Yes." In the OR, the anesthesiology team was struggling. The colonel's injuries made intubation complicated, and his deteriorating blood pressure meant they were running out of time. Maya entered the sterile field, gowned and gloved, and immediately took in the full scope of the crisis. "Report," she said, her voice carrying the authority of someone who'd commanded in far worse conditions. The anesthesiologist, Dr. Kumar, looked relieved to have direction. Severe thoracic trauma, multiple rib fractures, probable flail chest. "I'm concerned about hemothorax and possible cardiac tamponade. We need to secure the airway, but his anatomy is distorted from the trauma." Maya moved to the head of the table, her trained eyes assessing what Kumar couldn't quite see. The colonel's neck showed subtle signs of deviated trachea, a warning sign that standard intubation might be impossible. "We need a surgical airway," Maya said. "Cricothyrotomy. Now." "That's extremely aggressive for an OR setting," Kumar protested. "We should attempt standard intubation first. There's no time." Maya's hands were already moving, marking the anatomical landmarks on the colonel's neck. "In field conditions, you learn to recognize when standard protocols will fail. This is one of those times." Harrison stood in the doorway, watching. He didn't countermand her order, didn't step in to override her judgment. He was letting her lead, even though every instinct in his civilian-trained mind probably screamed that this was too radical. Maya performed the cricothyrotomy with practiced precision, creating a surgical airway in under 90 seconds. The colonel's oxygen saturation immediately began improving. Kumar stared at the procedure, then at Maya, with undisguised amazement. "I've never seen anyone do that so fast," he breathed. "You do it fast or the patient dies," Maya said simply. "Now let's address the chest trauma." Scalpel. As she made the initial incision, Maya felt the weight of observation intensify. Harrison had moved into the OR proper, positioned where he could watch her technique directly. The residents were packed into the observation gallery above, their faces pressed against the glass. Word had clearly spread through the hospital. The substitute surgeon was actually military. The quiet woman who'd seemed so unremarkable was a decorated combat veteran. Maya forced the awareness away and focused on what her hands were telling her. The colonel's chest cavity was a mess. Multiple rib fractures had created a flail segment that compromised breathing mechanics. Blood had accumulated in the pleural space, putting pressure on the lung, and beneath it all, she could feel the irregular flutter that suggested cardiac involvement. "Retractor," Maya commanded. "Large bore suction." I need better visualization. She worked with the controlled urgency of someone operating under time constraints that civilian surgeons rarely faced. Every movement was economical, purposeful. No wasted motion, no hesitation. Her hands moved through tissue with the confidence of someone who'd performed this exact procedure dozens of times in far worse conditions. That pattern, Harrison said from his position across the table. The way you're approaching the pleural space. That's not standard thoracotomy technique. It's combat thoracotomy, Maya said without looking up. Designed for speed and damage control rather than cosmetic closure. You stabilize what's bleeding, you evacuate what's causing pressure, you keep the patient alive long enough to get them to definitive care. But we are definitive care, Harrison pointed out. Then I'll refine it once he's stable. Right now, stable is the goal. Maya's fingers found the source of bleeding, a torn intercostal artery that had been pumping blood into the chest cavity. She clamped it, tied it off, then moved to address the pneumothorax. Her suture pattern was distinctive, recognizable to anyone who'd studied military trauma techniques. Interrupted stitches with reinforced anchoring, designed to hold under the worst possible conditions. From the observation gallery, she heard Webb's voice, excited and loud enough to carry through the intercom. That's exactly the pattern described in combat surgery journals. The Torres technique for rapid pleural repair. Maya's hands paused for half a second. The Torres technique. They'd named it after her. After a procedure she'd developed in a field hospital in Kandahar, when a young soldier's chest had been torn open by shrapnel and standard techniques were taking too long. You developed a named surgical technique, Harrison said quietly. That's not something temporary substitute surgeons typically have on their resume. I developed it because I had to, Maya said. Because soldiers were dying while I tried to follow protocols designed for peaceful operating rooms. She resumed suturing. Sometimes you adapt or people die. That's combat medicine. The colonel's vitals began stabilizing. Blood pressure rising. Oxygen saturation improving. Heart rhythm becoming more regular. Maya continued working, addressing each injury with methodical precision. The flail chest required stabilization. The hemothorax needed complete drainage. The cardiac contusion needed monitoring protocols she was already outlining to Kumar. As she worked, Maya became aware of a change in the room's atmosphere. The surgical team had stopped treating her like an outsider and started responding to her commands with the instant obedience of people who recognized competence. Harrison had stopped hovering with skepticism and started watching with something that looked like reluctant admiration. Dr. Torres, Kumar said from his position at the head of the table, his vitals are looking better than I thought possible 20 minutes ago. Whatever you're doing, it's working. I'm doing what I was trained to do, Maya said. Keep people alive when everything says they should be dead. She completed the final sutures and stepped back to assess her work. The colonel's chest rose and fell with mechanical regularity, aided by the ventilator. His color was improving. The monitors showed numbers that suggested life, rather than imminent death. Maya stripped off her gloves, exhaustion suddenly crashing over her like a wave. 3 surgeries in one shift, 2 emergencies that should have killed their patients, and the complete destruction of the anonymous identity she'd built over 3 years. Harrison approached as she moved toward the scrub sink. "We need to talk," he said. Not as chief of surgery to temporary staff, as one surgeon to another. Maya looked at him, seeing past the authority and ego to the man beneath. Someone who dedicated his life to medicine. Someone who understood what it meant to hold responsibility for human lives. "What do you want to know?" she asked. "Everything," Harrison said. "Why you left the military, why you've been hiding, and what it's going to take to convince you to stop running and actually use those skills where they're needed." Before Maya could answer, one of the military officers from earlier entered the scrub area. "Major Torres," the officer said formally. "Colonel Coulson is stable. Before he was sedated, he asked me to deliver a message. He said to tell you that you kept your promise. That you didn't leave anyone behind this time." Maya's breath caught. This time. The officer's words hit her like shrapnel, tearing open memories she'd buried deep. Kandahar. 3 years ago. A surgical mission that had gone catastrophically wrong. An evacuation order she'd refused to follow. Consequences that had cost her everything. Harrison was watching her face. There's a story there. he said quietly. One that explains why a decorated surgeon has been hiding in temporary positions for 3 years. Maya's hands were shaking again, not from exhaustion, from the weight of memory finally breaking through the walls she'd built. Yes, she said, there's a story. And if you really want to know, I'll tell you. But not here. Not now. The colonel needs post-op monitoring, Harrison said. You'll handle that personally. Then, when your shift ends, we're having that conversation. Because Metropolitan General doesn't let surgeons like you slip away into another temporary position, Major Torres. Maya nodded, too exhausted to argue. As she headed toward the ICU to check on her patient, she caught her reflection in a window. For the first time in 3 years, she recognized the woman staring back. Not the hiding civilian surgeon, not the anonymous substitute, but Major Maya Torres, who'd saved hundreds of lives and lost one she couldn't forget. The colonel crashed at 4:23 a.m. Maya had been monitoring his post-op vitals in the ICU, watching numbers that had seemed stable suddenly spiral into chaos. The alarms screamed their warnings as his blood pressure plummeted and his heart rhythm deteriorated into something that looked like ventricular tachycardia. Code Blue, ICU Bay 7, the overhead speaker announced with mechanical calm. Maya was already moving, her exhausted body finding reserves she didn't know she had left. The ICU nurses converged on the colonel's bedside, crash cart rolling in behind them. Through the glass wall, she could see Harrison running down the corridor, still in his blood-stained scrubs from earlier surgeries. What happened? Harrison demanded as he burst through the door. Cardiac tamponade, Maya said, her hands already on the colonel's chest, feeling for the telltale signs. The cardiac contusion from earlier is causing fluid accumulation in the pericardial sac. We need to drain it now, or his heart will stop completely. We need to get him back to the OR, Harrison started. There's no time, Maya interrupted, her voice carrying absolute certainty. We need to do a pericardiocentesis here, right now. Harrison stared at her. That's an extremely high-risk procedure to perform in the ICU without imaging guidance. Then it's good I've done it 43 times in field conditions with no imaging at all, Maya said, her eyes locked onto his. Doctor. Harrison, this is what I do. This is what I was trained for. Trust me or step aside. But make the decision now, because he has maybe 2 minutes before irreversible brain damage starts. For 3 seconds that felt like an eternity. Harrison held her gaze. She could see him processing, evaluating, weighing civilian protocols against the evidence of her competence. Do it, he said, stepping back. Maya turned to the nearest nurse. I need a cardiac needle, 18 gauge, at least 6 inches long. Local anesthetic, ultrasound if you have portable available, and someone to monitor vitals continuously. The ICU team moved with practiced efficiency, assembling the equipment she needed. Maya positioned herself at the colonel's side, her fingers finding anatomical landmarks by touch. The subxiphoid approach, threading a needle between ribs and diaphragm, aiming for the space between heart muscle and pericardial sac. In a field hospital in Afghanistan, she'd performed this procedure by flashlight while mortars fell outside. In a medical tent in Iraq, she'd done it during a sandstorm that made visibility nearly zero. This, by comparison, was luxury. Her hands didn't shake as she advanced the needle with millimeter precision. Too shallow, and she'd miss the fluid. Too deep, and she'd puncture the heart itself, killing the patient instantly. 37 millimeters, Maya said quietly, tracking depth by feel. 42, resistance changing. Almost there. Dr. Torres, the colonel's pressure is dropping, the monitoring nurse reported, her voice tight with stress. I know, Maya said. Keep calling vitals. I need to know if it gets worse. 53 millimeters. 58. Then she felt it, the subtle give as the needle penetrated the pericardial sac, the change in resistance that meant she'd reached her target. I'm in, Maya said, aspirating now. She withdrew the syringe plunger slowly, watching blood-tinged fluid fill the chamber. 50 milliliters. 75. 100. The pressure on the colonel's heart was releasing with each milliliter removed. The monitors changed their tone, heart rate stabilizing, blood pressure beginning to rise. The colonel's color improved from alarming gray back toward something approaching normal. Pressure's coming back up, the nurse reported, relief evident in her voice. 80/50, 90/55. Holding steady, Maya withdrew the needle with the same careful precision she'd used to insert it. The entire procedure had taken 4 minutes. In an operating room with full imaging and optimal conditions, it typically took 12. The ICU had gone completely silent. Every nurse, every resident who'd gathered to watch the code, even Harrison, stood frozen. They'd just witnessed something that shouldn't have been possible. A procedure performed with precision that bordered on miraculous, guided by nothing but trained hands and experience most surgeons would never accumulate in a lifetime. "How did you know?" Harrison asked quietly. "Without imaging, without confirmation, how did you know that was tamponade and not another arrhythmia?" Maya set down the syringe carefully. "Beck's triad," she said. "Hypotension, muffled heart sounds, jugular venous distension. Plus the pattern of decline matched every tamponade I've seen in combat casualties with blunt thoracic trauma." Her voice was matter-of-fact, clinical. "In the field, you learn to diagnose with your hands and your instincts because imaging isn't always available. You make the call, or the patient dies. You've done this 43 times, Harrison said, remembering her earlier statement. 43 emergency pericardiocentesis procedures without imaging. 44 now, Maya corrected, stripping off her gloves. In Afghanistan and Iraq, IED blasts cause specific patterns of injury. Cardiac tamponade is common. You learn the signs, you trust your training, and you act. Webb appeared in the doorway, his tablet in hand, his expression caught between awe and confusion. "I looked up your military record," he said. "The parts that aren't classified. Major Maya Torres, 6 years of service, 3 combat tours. Over 800 surgical procedures in field hospitals. Decorated twice for actions under fire. Developed 3 new trauma techniques that are now standard in combat medicine." He paused, reading from the screen. "It says here you refused evacuation orders during a siege at a forward operating base in Kandahar. You stayed to complete surgery on a critically injured Afghan child while the facility was under direct fire. The child survived. You were awarded the Bronze Star for Valor." Webb looked up from the tablet. "It also says you left the Army 3 years ago under circumstances that are sealed. No explanation given." The ICU felt suddenly smaller. The walls closer. Maya could feel everyone watching her, waiting for an explanation that she'd spent 3 years avoiding. "I made choices," Maya said finally, her voice quiet but steady. "Choices that saved lives but violated orders. In the military, there's a hierarchy, a chain of command. You follow orders even when those orders mean abandoning patients who will die without you." She met Harrison's eyes. "I chose the patients over the orders. I chose to finish the surgery instead of evacuating. And when the siege was over and the child lived, I was forced to resign my commission. The alternative was a court-martial that would have destroyed any chance of practicing medicine again." "So you've been running," Harrison said, "moving between temporary positions, hiding what you are, because you're afraid of what people will think when they find out you chose patients over protocols." Maya felt something crack inside her, the wall she'd built around the memory finally breaking. "I'm afraid because I was right," she said. "I was right to stay. I was right to finish that surgery. And the Army punished me for it anyway. For 3 years, I've been trying to figure out how to be a surgeon in a world that values rules over results." The colonel stirred on the bed, semi-conscious from sedation, but aware enough to hear. His hand moved slightly, reaching toward Maya. His lips formed words that barely carried sound. "Thank you," he whispered, "for not giving up, for staying." Tears pricked at Maya's eyes. She blinked them back, maintaining the composure that had carried her through 6 years of war and 3 years of hiding. Harrison stepped forward, his expression transformed from skepticism to something that looked like respect, mixed with determination. "Dr. Torres," he said formally. "Major Torres, the policies I enforce here are designed to ensure patient safety and maintain standards of care. But what I witnessed tonight challenges every assumption I made about military medicine versus civilian practice." He paused. "You saved 3 lives in one shift under circumstances that would have broken most surgeons. You performed procedures I've only read about in journals. And you did it all while carrying a burden of judgment that was fundamentally unjust. Harrison glanced at the colonel, then back at Maya. Metropolitan General needs surgeons who can make impossible decisions. We need someone who can teach others what you know, who can bridge the gap between combat medicine and civilian practice. I'm offering you a permanent position, not as a substitute, as director of a new trauma program combining military and civilian techniques. Maya's breath caught. A permanent position. Recognition. The chance to stop running. But there was still fear. Fear that people would judge her for the past. Fear that the weight of command would crush her again. Fear that she'd make another choice that cost her everything. I don't know if I can, Maya said quietly. The colonel's hand squeezed hers with surprising strength. You stayed for me, he said, his voice gaining clarity. 3 years ago in Kandahar, I was there. I saw what happened. The evacuation order was wrong. The intelligence was wrong. The base wasn't under real threat. They pulled us out for political reasons, not tactical ones. Maya stared at him. You were there? Major General Richard Coulson, he said. I commanded the regional operations. The evacuation order came from my superior, but I was the one on the ground. I knew the intelligence was faulty, and I watched you refuse to abandon that child, knowing what it would cost you. His eyes held hers. You saved that girl's life, Major Torres, and you saved mine tonight. The military failed you. Let us make it right. Let us help you build something that ensures no surgeon ever has to choose between orders and doing what's right again. The ICU was silent, except for the steady beeping of monitors showing a life saved multiple times over. Maya looked at Harrison, at the residents watching through the glass, at Nurse Patterson who stood in the corner with tears streaming down her face, at the colonel whose life she'd pulled back from the edge twice in one night. She thought about 3 years of running. 3 years of temporary positions and hidden expertise. 3 years of being less than she was because she'd been afraid of being seen. Then she thought about the Afghan child in Kandahar, about every soldier she'd saved under impossible conditions, about the colonel breathing steadily because she'd refused to give up. Maya took a deep breath and made a decision that terrified and liberated her in equal measure. I'll take the position, she said, on one condition. We build a program that prioritizes saving lives over following rules. That trains surgeons to make decisions based on what's right, not what's safe. Harrison extended his hand. Deal, he said. As Maya shook his hand, she felt something she hadn't experienced in 3 years. Not just acceptance, but belonging. Major Maya Torres was done hiding. 2 weeks after the mass casualty incident, Maya sat in Harrison's office surrounded by paperwork that would transform her from temporary substitute to permanent staff. The contract sat on the desk between them, official and final. Director of Trauma Integration Program. It felt surreal. You're hesitating, Harrison observed, leaning back in his chair. After everything that happened, after proving yourself beyond any reasonable doubt, you're still hesitating. Maya's fingers traced the edge of the contract. 3 years of running had taught her to be cautious. Permanent positions meant visibility. They meant commitment. They meant people would look closely at her past. I keep thinking about Kandahar, she said quietly. About the choice I made that cost me my commission. What happens when I make another choice like that here? When civilian protocols say one thing and my training says another? Harrison was quiet for a moment, then pulled out a folder from his desk drawer. Inside were dozens of letters, emails, and official communications. Maya could see military letterheads, Department of Defense seals, hospital administrative signatures. These started arriving 3 days after the colonel's surgery, Harrison said. Letters of recommendation from every soldier you operated on that night. Official commendations from the 82nd Medical Battalion. A formal request from the Department of Defense asking if we'd be willing to host a military-civilian surgical training program. He pushed the folder toward Maya. You think you're the only one who's been questioning whether you belong here? The entire military medical community has been trying to figure out where Major Maya Torres disappeared to for 3 years. Apparently you're something of a legend in combat surgery circles. Maya flipped through the letters, her throat tightening. Soldiers she'd saved, commanding officers she'd served under, medical personnel who'd worked alongside her. All of them vouching for her competence, her character, her judgment. One letter caught her attention. It was from Colonel Coulson, now fully recovered and back on limited duty. Maya read his words slowly. Major Torres represents the best of what military medicine can offer civilian healthcare. Her refusal to abandon patients, even under direct orders, is not insubordination. It is the highest form of medical ethics. Any institution fortunate enough to employ her should recognize that her judgment, forged in the most demanding conditions imaginable, is an asset rather than a liability. The colonel's letter went on to detail the incident in Kandahar from his perspective, how the evacuation order had been based on faulty intelligence, how the base had never been in actual danger, how Maya's decision to stay and complete the surgery had been tactically sound as well as morally correct. The investigation afterward was political retaliation, Coulson wrote, not justice. Major Torres was punished for making command look incompetent. She saved a child's life and exposed failures in intelligence assessment. Rather than acknowledge the mistakes, certain officers chose to force her resignation. Maya set the letter down, her hands shaking slightly. For 3 years, she'd carried the weight of believing she'd failed, that her choice had been wrong, that she deserved the consequences. You were set up, Harrison said gently, punished for being right. And you've spent 3 years hiding because you thought you deserved it. I violated direct orders, Maya said. In the military, that's unforgivable. You prioritized a patient's life over bad intelligence and political convenience, Harrison corrected. In medicine, that's called having a backbone. Before Maya could respond, there was a knock on the door. Nurse Patterson entered, followed by Webb, Park, and Chen. The residents looked nervous but determined. Dr. Torres, Webb said formally. We wanted to speak with you before you signed that contract. Maya braced herself. This was where they'd tell her they didn't want to work under someone with a controversial military record, that they preferred traditional civilian training. We've been talking, Park continued, about what we witnessed during the mass casualty event, about your techniques, your decision-making, your ability to handle situations we've only read about in textbooks. Chen stepped forward. We looked up the Torres technique for rapid pleural repair. It's cited in 17 different trauma journals. Your work on battlefield pericardiocentesis has been adopted by 3 major hospital systems. You've literally written the protocols we study. We want to learn from you, Webb said. Not despite your military background. Because of it. You operate at a level we've never seen. You make decisions under pressure that most surgeons can't handle. And you do it while actually caring whether your patients live or die. Park pulled out her tablet. We've drafted a proposal for the trauma integration program, how we think it should be structured, what we want to learn, how to combine civilian protocols with combat medicine techniques. She hesitated. If you'll teach us. Maya looked at the 3 residents, their faces showing a mixture of respect and genuine eagerness. These were the next generation of surgeons. They could learn from her mistakes as well as her successes. Teaching means I'll push you harder than you've ever been pushed, Maya said. Combat medicine doesn't allow for hesitation or uncertainty. You'll learn to make decisions in seconds that typically take hours of deliberation. We know, Chen said. That's exactly what we want. Patterson spoke up from the doorway. The nursing staff wants in too. We've already started documenting your techniques, creating training protocols. Your approach to patient assessment, your triage methodology. It's different from what we've learned, but it works. Maya felt something shifting inside her. Not just acceptance, but purpose. The reason she'd become a surgeon in the first place. To save lives, to teach others, to make the impossible possible. She picked up the pen and looked at Harrison. I have conditions, she said. 3 non-negotiables. Name them. Harrison replied. First, this program prioritizes patient outcomes over procedural compliance. If a patient's life requires breaking protocol, we break protocol and justify it afterward. Agreed. Second, we recruit military veterans into the program. Surgeons, nurses, medics who've served and are struggling to transition to civilian medicine. We give them a place where their experience is valued. Already working on it, Harrison said. The VA has expressed interest in partnership opportunities. Third, Maya's voice was firm. When I make a decision to save a patient's life, even if it's controversial, this hospital backs me. No politics, no scapegoating. We defend the choice to prioritize lives over convenience. Harrison extended his hand. You have my word, and the full support of the hospital administration. They've reviewed the colonel's letter and the Department of Defense recommendations. Metropolitan General is committed to making this work. Maya signed the contract, her hand steady. As she set down the pen, she felt the weight of 3 years of running finally lift from her shoulders. Welcome to Metropolitan General, Dr. Torres, Harrison said. Permanently. The residents erupted in restrained celebration. Patterson wiped at her eyes, and Maya allowed herself, for the first time in 3 years, to imagine a future where she didn't have to hide who she was. Over the next week, Maya threw herself into designing the trauma integration program. She drafted protocols that combined civilian thoroughness with combat efficiency. She created training modules that taught residents how to make rapid assessments under pressure. She reached out to former military colleagues, inviting them to join a program that recognized their unique expertise. Colonel Coulson visited on his way back to active duty. He found Maya in the simulation lab, teaching Webb how to perform emergency thoracotomy, using the technique she'd developed in Afghanistan. You're exactly where you're supposed to be, Coulson told her. Doing exactly what you were meant to do. I'm still figuring that out, Maya admitted. 3 years of hiding doesn't disappear overnight. No, Coulson agreed. But 3 years of running means you know what you're running toward now. You're not hiding anymore, Major. You're building something that matters. He handed her an envelope. Inside was an official letter from the Department of Defense, a formal apology for the handling of the Kandahar incident, an offer to restore her military rank with full honors if she chose to return to active duty, and a commendation recognizing her contributions to combat medicine. You have options now, Coulson said. You can return to the military. You can stay here. You can do both through reserve status. The point is, you're not trapped anymore by someone else's mistakes. Maya read the letter twice, processing what it meant. Official recognition that she'd been right, that her choice had been correct, that 3 years of guilt and hiding had been based on an injustice rather than a failure. I'm staying here, Maya said finally, building this program, teaching the next generation, making sure no surgeon has to choose between doing what's right and following orders that are wrong. Coulson smiled. Then the military's loss is civilian medicine's gain. As he left, Maya returned to the simulation with renewed purpose. Webb was practicing the thoracotomy technique, his movements growing more confident with each repetition. Better, Maya said, but you're still hesitating at the critical moment. In combat, that hesitation costs lives. Trust your training. Trust your hands. How do you do it? Webb asked. Make decisions so fast without second-guessing. Because I've seen what happens when you hesitate, Maya said. And I've learned that saving lives sometimes means breaking rules. The key is knowing which rules exist to protect patients and which ones exist to protect institutions. She demonstrated the technique again, her hands moving with the practiced precision that had saved hundreds of lives. This is what I can teach you. Not just the mechanics, but the judgment. The ability to look at an impossible situation and find the path that saves lives. Webb watched intently, then tried again. This time, his hands moved without hesitation, following the pattern Maya had shown him. That's it, Maya said. That's exactly right. As the sun set outside the simulation lab windows, Maya Torres finally allowed herself to believe that she was home. Not just in a building, but in a purpose. Building something that bridged 2 worlds, that honored both military precision and civilian compassion, that proved you could save lives without sacrificing your principles. The substitute surgeon was gone. In her place stood Major Maya Torres, MD, ready to teach others what she'd learned in the hardest school imaginable. And for the first time in 3 years, that felt exactly right. 4 months after accepting the position as Director of Trauma Integration, Maya stood in the Metropolitan General Conference Room, facing an audience that would have been unimaginable during her years of hiding. 37 medical professionals filled the seats. Civilian surgeons, military veterans, residents eager to learn, nurses with decades of experience. All of them had come to hear about the program that was transforming how trauma medicine was practiced. The statistics displayed on the screen behind her told a story of success that still felt surreal. 28% reduction in trauma mortality rates. 47 medical personnel trained in combined military-civilian techniques. 15 military veterans successfully integrated into civilian medical positions. 3 new protocols adopted by hospitals across the region. But the numbers only told part of the story. Maya clicked to the next slide, showing a photograph of Colonel Coulson standing beside a young Afghan woman, the same child Maya had refused to abandon 3 years ago in Kandahar. The girl was now healthy, studying medicine at a university, alive because a surgeon had chosen patients over protocols. This program exists because of a simple truth, Maya said to the assembled professionals, that saving lives sometimes requires courage to challenge systems that prioritize convenience over patients. That experience gained in combat zones has value in civilian settings, that veterans transitioning to civilian medicine deserve recognition rather than skepticism. In the front row, Harrison nodded approvingly. Beside him sat representatives from the Department of Defense, the Federal Emergency Management Agency, and 3 major hospital systems interested in replicating the program. What had started as one substitute surgeon's desperate attempt to hide had transformed into a national model for trauma care. Webb raised his hand from the second row. Dr. Torres, can you talk about how the program addresses the psychological challenges military surgeons face when transitioning to civilian practice? Maya had been waiting for this question. It was the piece that textbooks and protocols never addressed. The invisible wounds that came from operating in war zones, from making decisions that haunted you, from carrying responsibility for lives lost and saved. Combat medicine changes you, Maya said quietly. You learn to function in chaos that would paralyze most people. You develop instincts that can seem aggressive or reckless in civilian settings, and you carry memories that make it hard to connect with colleagues who've never faced those situations. She paused, gathering her thoughts. This program creates space for those experiences. We pair military veterans with civilian surgeons so both can learn from each other. We provide psychological support that recognizes combat trauma without treating it as weakness. And we build a community where veterans don't have to hide who they are or what they've survived. From the back of the room, a young woman in military uniform stood. Captain Jennifer Morrison, recently separated from the Army Medical Corps. Maya had recruited her 2 months ago after learning she was struggling to find civilian employment despite exceptional credentials. Before this program, Morrison said, her voice steady but emotional, I applied to 17 hospitals. 13 rejected me outright because my experience was all military. 4 offered positions but wanted me to essentially forget everything I'd learned in combat zones and start over as if I were fresh out of medical school. She looked at Maya. Doctor, Torres didn't just offer me a job. She offered validation that what I know has value, that the decisions I made under fire were medical judgment, not just military training, that I belong in civilian medicine not despite my background, but because of it. The room was silent as Morrison sat down. Maya saw several people wiping at their eyes, including Nurse Patterson, who'd been the first to recognize Maya's hidden expertise. Our program has trained 47 professionals so far, Maya continued. But across this country, thousands of military medical personnel are transitioning to civilian life every year. Many of them struggle with employment, with integration, with feeling like their skills don't matter outside combat zones. They're the hidden resource civilian medicine needs, but doesn't know how to access. She clicked to the final slide, showing contact information and program details. We're expanding this program nationally next year. 23 hospitals have committed to creating similar integration initiatives. The Department of Defense is providing funding for veteran recruitment and training. And we're developing certification programs that bridge military and civilian medical credentials. But the real success, Maya said, isn't measured in statistics or expansion plans. It's measured in the surgeons who stop hiding, the veterans who find purpose again, the patients who survive because someone had the courage to trust experience that came from impossible situations. After the presentation, Maya was surrounded by people wanting to discuss partnerships, ask questions, share their own stories of military service and civilian transition. She answered each inquiry with patience, recognizing herself in every veteran who spoke about feeling lost between two worlds. Harrison eventually extracted her from the crowd, guiding her to his office where they could speak privately. "You've built something remarkable," he said, genuine admiration in his voice. "4 months ago, you were a temporary substitute I barely trusted. Now you're transforming trauma care nationally and giving veterans a pathway home." Maya looked out the window at the hospital campus below. "I'm just doing what I wished someone had done for me 3 years ago. Creating space for people to be who they are without apology or disguise." Her phone buzzed with a message from Colonel Coulson. The Afghan girl from the photograph, now studying medicine, wanted to speak with Maya about potentially joining the program as an intern. The circle coming complete in ways that still took Maya's breath away. "Dr. Torres," a voice called from the doorway. Webb stood there with Park and Chen. "We've got an incoming trauma. Multiple vehicle collision. The patient specifically requested you." Maya grabbed her white coat, the one that now had her full credentials embroidered clearly. Major Maya Torres, MD, Director of Trauma Integration. No more hiding. No more substitute positions. Just the truth of who she was and what she could do. As she walked toward the trauma bay, she thought about the journey that had brought her here. 3 years of running from a past that had actually been her greatest strength. 3 years of temporary positions when what she'd needed was permanence. 3 years of hiding when what she'd craved was recognition. The substitute surgeon who'd appeared in Harrison's ER 4 months ago barely existed anymore. In her place stood a woman who'd learned that courage wasn't just about operating under fire. It was about standing still long enough to build something lasting. About refusing to let unjust consequences define her worth. About transforming pain into purpose. Maya Torres had stopped running, and in standing still, she'd discovered she could fly. But Maya's journey is just one story among thousands. Across this nation, countless military veterans are struggling with similar transitions, carrying expertise that civilian medicine desperately needs, but doesn't know how to recognize. They're stories of transformation, of finding purpose again, of proving that combat experience has value beyond the battlefield. These stories deserve to be heard. If this journey moved you, if you believe that those who serve in impossible conditions deserve recognition rather than skepticism, then join our community. Share your thoughts in the comments below. Tell us about the veterans you know, the medical professionals who've inspired you, the moments when someone refused to give up when everyone else had walked away. We've shared Maya's transformation with you tonight, but there are countless other stories of courage, dedication, and the fight to be recognized for who you truly are. Stories of surgeons who operate in the space between protocols and possibility. Tales of medical professionals who choose patience over convenience, who make impossible decisions, who transform tragedy into triumph. If you want to hear more stories like Maya's, stories that challenge what you think you know about medicine, courage, and the price of doing what's right, make sure you subscribe to Emergency Heroes Stories. Hit that notification bell so you never miss when we release our next journey into the lives of medical professionals who operate beyond the limits of what most people think possible. Thank you for being here tonight. Thank you for witnessing Maya Torres' transformation from a hiding substitute to a leader who's changing how we think about trauma medicine and military-civilian integration. Your time means everything to us. Until our paths cross again in the next story, remember that sometimes the people who seem the most ordinary are actually the most extraordinary. They're just waiting for someone to see past the disguise to the truth beneath. And that truth can change everything.